What we're talking about today is the first day that you guys came in is kind of like our discovery day. We're trying to find out exactly what's going on with you. The second day today is the problem report. So I'm not going over your individual information as together, we'll do that individually. There are some basic concepts though that I want you guys to know about, and I'll explain what we're looking for from a test perspective and what the test results look like, and then we'll go over your individual test results separately. The reason why we do this is just honestly to kind of, it's a bit redundant. Some of the conceptual ideas are a bit redundant, so we want you to know, we want you to have the background information as to what we're looking for, what we're trying to accomplish, and so it just makes our schedule a little bit easier. We can do that together. And the significance, it kind of looks like a classroom in here, and it's supposed to, because one of the keys to being healthy that we know of for sure is actually understanding how the body works and what causes it to be sick and how to get that back. I'm not going to do a health lecture today, but I do want you guys to know the United States, our healthcare system is terrible. And the way that we approach health is from a disease perspective. And so we're always treating sickness and illness, and we're never looking at trying to build health. Does that make sense? If you guys have ever heard of anything like like how to have a happy life, or more money or whatever, all of the experts say you never focus on the thing that you don't want, right? So we're constantly focusing on the disease. And I heard a guy, a couple weeks ago, was talking about the problem that our healthcare system is having is that it was not designed to create health. When our healthcare system was created, do you know what the number one issue was that people were having? Do you guys know this? Do you know? It was infectious disease, right? Everybody was infected. And so all of our healthcare procedures were designed to handle that infection. And the system was built for acute care. Remember, they used to even call it hospitalization. Some of our patients will still ask, does my hospitalization cover any of this? I'm like, well, it's not a hospital. So either no, or maybe your health insurance does, but it's not. Anyway, the point is, what we've now created is this chronic disease, chronic health issues, because the most significant factors that we have that we're dealing with now, do you guys know what they are? There's 3 of them, 3 causes of health problems, 3 forms of stress. Do you know what these 3 forms are? What do you think?
Inflammation?
Yeah, what causes, this is the causes of inflammation. You're right. You're on track.
Our foods, what we eat.
Yes, toxicity. So sugar and chemicals. So we eat as much sugar in one day as our ancestors ate in an entire year. We're exposed to more synthetic chemicals than at any point in time in the history of the world.
I don't know, probably this gum, it's...
It is, actually. It's got aspartame in it, and so you're right. That's exactly right. So now chemical stressors are one of the major issues of causing health problems. Second is stress, just emotional stress, mental stress is the next big thing, and probably the third is physical stress. The 2 that are kind of like aside are infections still, but they're not acute infections, they're chronic infections, meaning that a person gets some sort of bug and our immune system is not strong enough, does not pack enough punch to be able to wipe it out. So it lingers, and it lingers for years, months, years, and even decades. The last thing is technology. So we got, your body is made up of energy, little electric current. Your cells all have an energy frequency. If we tested them, they would have a charge. we have man-made electromagnetic frequencies that are interacting with our body like never before. And the energy, the electrical energy that we've created on the earth is more significant now than it has ever been at any point in time in history. And so that's having an effect on us. Anyways, bottom line is, all of these things push us into what's called sympathetic dominance. What that means is, you have your autonomic nervous system. That means your breathing, your heart rate, your immune system, all of those subconscious things that you don't necessarily think about. Your blood sugar, your hormones, all those things controlled by your autonomic nervous system. There's two branches. One is sympathetic, which is fight or flight survival. The other is parasympathetic. Parasympathetic is rest, restore, repair. There's supposed to be a balance, like if you think of a needle or a scale, right? There's supposed to be a balance between sympathetic and parasympathetic. So you encounter a stressor, and it could be any of those things that I just talked about. Chemicals, emotional stress, physical stress, which is sitting, gravity, slips, falls, car accidents, and whatever else. Those things all push us into this sympathetic dominance because they utilize energy. So the first concept is sympathetic dominance over parasympathetic. That sympathetic dominance uses more energy. Okay? So your body has a limited amount of energy that it can create. So if you're toxic, your body's spending a lot of energy trying to detoxify you. If we're coming in contact with all these chemicals, we're always trying to get rid of them. If we have stress when we're driving down the road, right? Or when you're sitting at home and you think that your brain doesn't know the difference between a dog chasing you and you being worried about your bills, or your family, or your kids, or your whatever, right? That still elevates our heart rate, puts us into this sympathetic, you guys all know this fight or flight response. If we don't have enough energy, we can't pull back from that. And then things start to not work right. We call this energy debt. So the body gets into this compensation survival mode, which creates dis-ease, and that eventually leads to symptoms. So all of this stuff that we're talking about is the result of stress and the body not having the energy to be able to make up the difference. Okay? That is the bottom line. And the good news is we're able to make a significant change in that. But you got to know where you're at in order to make a change. So the first thing we're going to look at today is X-rays, one of the things that we look at. So you should have a C-shaped curve in the neck, C-shaped curve in the lower back, C-shaped curve in the mid-back going the opposite direction. And all of those things should line up. Your ears over top of your shoulders, shoulders on top of your hips. The first thing that happens when we lose, again, the body doesn't make mistakes, it makes compensations. So if it's putting a lot of energy to your liver, to your gut, to your brain, it's not going to spend as much energy fighting gravity. So you start to lose normal posture. So the first thing is we affect the alignment, which is the muscles, ligaments, tendons. They start to lose their control over the system, which is supposed to be in this normal upright position. So the second, and I should have written this differently, but it's the ACBs, but ABCs makes, it's like a little label on it. So the C is for cartilage. It starts to affect the cartilage, which you could also think of as ligaments too, but the cartilage between the joints starts to break down. So if you have bad position, it puts uneven stress on the joint. It starts to affect the cartilage. That's phase 2. If it gets all the way to phase 3, that means that you're starting to get bone spurs and it's starting to break down the bone. The bone is actually starting to change. So we're going to look at that. If you're in phase 3, we know that's an advanced problem. The last test we're going to look at is this core score, and if you guys remember this testing, hopefully Dr. Zach explained it to you. But the first thing is this thermography, the thermal scan. So the thermal scan is measuring the temperature of the skin over the spine, and its job, the nervous system's job, is to keep these are both supposed to be equal. Unless you were leaning against a heater or something like that, which is not the case. But being that they're supposed to be equal when they're not, we know that that's a gland that has gotten to the point where the nervous system, there's an interference to the nerves to where it's affecting the gland and organ control, because your skin is the largest organ in the body. So we can look at this and see where areas of nerve interference or nerve dysfunction are happening. Next is the EMG, which is the muscle activity. So it's telling us if certain muscles are more active than others. Why would a muscle be more active?
Because you're using it.
Yeah, for what? In your spine, why would it be more active than another one? It's a good question, right? It's number one, it's protective. So if there's an area that's been damaged, or the muscles, the ligaments are not doing what they're supposed to do, the muscles will kind of clamp down and tighten up around it to protect it. So the muscles are working harder. The other thing is, if I hold a bowling ball out in front of me like this, is it harder or easier than if I hold it in close to my body?
Be harder.
It's a hell of a lot harder, right? So when our head starts doing this, or we start getting away from our center of gravity, so the research shows that for every inch that you are off of your center of gravity, it adds 10 pounds of stress to your spine. So those muscles will work a lot harder because we've lost our normal balance. Last thing is what we call heart rate variability, which is a medical test that's testing the balance in our nervous system in the output. So output, meaning like power, energy reserve, is on this left side. That's the autonomic activity. It could be called like the autonomic power, the autonomic energy reserve, the amount of energy that's your nervous system has to use. And then this one is the balance between the fight or flight and the rest restore. And so if we're always functioning out of this stressed out state, the body cannot repair and it can't restore, and that's where we see this gland and organ dysfunction occurring. And that's where diabetes shows up, and that's where autoimmune problems show up, and all the other things that happen after that.